And thank you and welcome to today's webinar. And if you have just joined us, go ahead and put your name in the chat. I will go to the next slide. So today's webinar for our SHIP and SMP volunteers is getting ready for Part D enrollment. So of course, as you all know, open enrollment or annual enrollment, depending on who's talking, starts October 15th, but we can begin previewing plans now. So that's why we're having this webinar, just so we can all get prepared on how to best help beneficiaries, their families, and caregivers review plans, look at their options, and to make some decisions. So it's going to be kind of technical, but and kind of not. Again, I'm Adrienne Franklin. I'm the SHIP coordinator for the Aging Commission of the Mid-South. We serve 4 counties, as you know, Fayette, Shelby, Lauderdale, and Tipton. And today we're going to go over Medicare Part D and Medicare Advantage plans, particularly updates, but also some standard information. We're going to take a quick look at the Part D worksheet that we often use to help us in our counseling, as well as take a look at Medicare Plan Finder. It's a little different. Oh, forget it. It's a lot different from last year. Let's just tell the truth. Heck, it's different from last week. And those of you who know me on previous webinars know anytime I talk about Plan Finder, it's like, yep, whatever I say today is for today, possibly for tomorrow. We'll see what happens next week. Then we're going to go over some enrollment fraud prevention because this is the time for legitimate and illegitimate actors to get busy trying to sign people up for Medicare plans, particularly Advantage plans. We have those who are ethical in what they do, and unfortunately, we have those who are very unscrupulous. And we want to make sure that we help our beneficiaries avoid those. We'll take a very, and I do mean very brief look at beneficiary contact form and reporting deadlines. We just had our webinar last week, and I know I said I'd have it on YouTube by Monday. The calls have jumped up, y'all, so I apologize. But I will have it by today because I want to go into the weekend free and clear of conscience. So we will have the recordings for last week as well as today up by the end of the day. And I will send you all an email on that for our YouTube page. So for a longer discussion about the beneficiary contact form and reporting deadlines, you'll refer to that particular webinar, but I always like to have a brief reminder in there. Then, of course, we'll give our contact information and hopefully have time left over for Q&A. Although there will be some times throughout the presentation where we can stop and also take questions, and you can feel free to type a question in the chat as well. Again, if you're just joining us, don't forget to type your name in the chat so that we can have your name for attendance, and please mute your lines until we get to the Q&A portion. All right, so here we go. So Medicare Part D. Medicare Part D is the standalone prescription drug coverage for those who have original Medicare. These are provided by private insurance companies contracted by Medicare. It's not required if a beneficiary has creditable prescription drug coverage. For example, if they have coverage through their employer group health plan or their spouse's employer group health plan. This is active insurance. There are many retirement plans that are considered creditable, and they do have to notify their their enrollees in writing that they're creditable for Medicare. Also, VA or TRICARE coverage would count as creditable prescription drug coverage. So beneficiaries may ask you about that. So if they do have creditable coverage for prescriptions, they are not required to get prescription drug coverage through Medicare. However, if they don't, it would be most likely beneficial for them to do so to avoid what we'll talk about later, the late enrollment penalty. Medicare Part D coverage, and even though right now I'm speaking of the standalone Part D plan for original Medicare, this does also apply to Medicare Advantage plans that have Part D coverage included. So Part D covers outpatient prescription drugs and most vaccines and shots. It does not cover drugs that are already covered by Medicare Part A or Medicare Part B. For instance, Part B, you have some preventive vaccines like the flu vaccine and the one for the pneumonia, COVID. Those would be covered by Part B, so that wouldn't come under your Medicare Part D. And then when you're in the hospital, some of the drugs that you're given there under Part A would not come under your Part D coverage. Also, most prescription vitamins and minerals or over-the-counter medicines would not be included Drugs used to treat anorexia, weight loss or gain, fertility. I won't read everything, but you can see here the common cold. Like I tell folks, just get some NyQuil or whatever you can stomach for that. It does not cover drugs for ED. Drugs that are not FDA approved will not be covered by Medicare Part D. And then drugs used for off-label purposes in most cases, meaning that whatever the drug is listed with the FDA as we treat A, B, C, and D, if you're prescribed it for reason E, in most cases, it's not going to cover that. Now, Medicare drug plan costs. These costs do vary by plan. In 2021, most people will pay a monthly premium, and that's going to vary by plan and income. That's true for 2021 and 2022. There's a yearly deductible. This year, it's $445 max. In 2022, the maximum is going to be $480. So that's the most deductible price that someone should pay. There will be, in most cases, copays and coinsurances. If someone is in the coverage gap, they will pay 25% of the retail cost of the prescription. This year, the coverage gap starts when the beneficiary and the plan have spent together $4,130 on prescriptions. Next year, that jumps to $4,430. And for what we call catastrophic coverage, people will spend generally 5% of costs. And that's when out of pocket costs have reached $6,550 this year. In 2022, that will be $7,050. So it would be a higher, you'd have to spend more in order to get catastrophic coverage. So I've got the 2021 and 2022 information that was released. And so we want to make sure that our beneficiaries are aware. And the reason I'm still mentioning 2021 costs is even though our annual enrollment, of course, is for 2022 coverage, we still have people who are having 65th birthdays right now and through the end of the year. And therefore, they may need a plan just to cover them for these next couple of months. So I've had plenty of times where I've signed somebody up for two plans. Here's your 2021 plan from November to December, and here's your 2022 plan from January on. So it still is helpful to know what the costs are in both. So the Part D monthly premium and income related monthly adjustment amounts, also known as IRMA. This is based on a person or married couple's income above a certain limit. Fewer than 5% of people will pay a higher premium for their prescription drugs as well as for their Medicare Part B. The IRMA applies to both Part B and to your Part D, and it's the same thresholds are used to compute both. And what they're going to look at is a beneficiary's income as reported on their tax returns from 2 years ago. So since this is 2021, if they're signing up for a 2021 plan, they'll be looking at their 2019 tax returns. For 2022 plans, they'll be looking at their 2020 tax returns. A person is required to pay this if they have Part D coverage. If they don't pay, they will be disenrolled from their Part D plan or their Medicare Advantage plan that has drug coverage. And that extra amount does not go to the plan, it goes to the Medicare Trust Fund. Now, I don't have the amounts for 2022, so we're just going to deal with 2021. And again, this is based on someone's yearly income from 2019. So in the left corner, this is for people who file individual tax returns. They're single and filing individually. Most people, if they make $88,000 or less, are just going to, they're not going to have a surcharge to their premium. So whatever premium that's advertised, that's the premium these people will pay. If they're filing a joint tax return, then that joint income of $176,000 or less, again, they're not going to have a surcharge on their prescription coverage premiums. If a couple is married, but they file separate tax returns, again, we're back to that $88,000 or less, no surcharge. And as you can see, if you go down the chart, you can see the different categories and how much more a person would be charged. So I won't read the whole thing, but just to give an example, let's look at that second line. So let's say you have a single individual whose income in 2019 was between $88,000 and $111,000. In that case, whatever the advertised premium is for that prescription drug plan, or if they have an Advantage plan with drug coverage and there's a premium for that, they will pay an additional $12.30. So just as an example, this year, SilverScript Smart RX has a premium of $7.30, I believe. So if that person picked that plan, you would let them know that if they're in this category, they would pay the 730 to SilverScript and they would pay $12.30 to the Medicare Trust Fund. So their total payment for having that plan would be about $19 and change. Yes, I'm lazy. I'm not doing the math. $19 and change. And so on and so forth. As you move through the categories downward, you can see on the right-hand side what that IRMA amount is going to be on top of whatever premium for whichever plan they choose. And hopefully we'll get the 2022 amounts soon, but these are the 2021 amounts. All right, so Medicare Part D enrollment. When does a person have the opportunity to enroll? And of course, many of you already know this, so some of this is recap. Of course, you have your initial enrollment period, which is going to be that 7-month window surrounding your 65th birthday. So that's the 3 months before your birth month, and the 3 months after. And although I don't have it here, that also is for people who are reaching their 25th month of being on Social Security disability benefits, same 7-month window. But instead of using that month of turning 65, it's going to be that 25th month of having Social Security disability insurance, because that's when they're going to be automatically enrolled into Medicare for A and B. And this is when they can also pick up a drug plan. The period that we are mostly concerned with now, of course, is the annual enrollment period, which starts October 15th. That is a week away. Wow, 7 days. So October 15th through December 7th each year. During this period, a Medicare beneficiary can join, drop, or switch coverage. So if they've never had a plan before, they can start now. If they have a plan and they don't want to ever have a plan again, they can drop now. Or if they want to review their coverage and decide that, I think that other plan is going to be better for me than the one I have now, they can switch. Whatever change they make will be effective January 1st of the following year. So, of course, in this case, January 1st, 2022. Now, there are also special enrollment periods, and those can just depend on the circumstances. For instance, if someone moves to a new area, a new service area, they usually get 2 months. If someone moves into a nursing home, lives in a nursing facility, or moves out of one, if someone gains or loses extra help with their prescription costs, someone retires and therefore they're losing their coverage at work, or they're not retiring, they're just losing their coverage at work. So all of those would be special enrollment periods. Their plan drops out of the Medicare system. So all of those would give them a special enrollment period. And now for the late enrollment penalty. So if a beneficiary does not sign up for a prescription drug plan either during their initial enrollment period, which again is going to be based either on turning 65 or having the 25th month of Social Security disability insurance, or during a special enrollment period, if they don't sign up during one of those, they could accrue a late enrollment penalty. And you can see here what the math is for that. 1% of the national base premium for every month you were eligible for Part D but did not take it. This also means you didn't have creditable coverage, which would have allowed you, of course, to delay taking Part D. So if you're in this situation, or a beneficiary that you're counseling is in this situation, you can let them know about the possibility of them having a late enrollment penalty. What will happen is when they sign up for a plan, that plan will contact them to let them know if it's possible that they could have a late enrollment penalty. They'll send them something letting them know that, hey, it doesn't look like you had creditable coverage for X amount of time. If you have proof of this and we're just not aware, go ahead and send it to us so we can not, you know, get you this penalty. If you don't have proof, sorry, penalty. It will be said far more professionally than that, but that's the gist of it. Now, if a person receives low income assistance with their Part D costs, then that penalty will be waived. So it's important to know this if we have someone who looks like they may be getting a penalty, but it also looks like they may qualify for low income assistance. It's important to share that information. Now, Medicare Advantage plans, or it's commonly known as Part C. This is private health insurance that company company administers your Part A and your Part B benefits. So with original Medicare, your Part A hospital, your Part B benefits, which is medical, those are administered directly by Medicare. But when you have a Medicare Advantage plan, a company is contracted. So just for example, WellCare or Cigna are contracted by Medicare to administer these benefits for the beneficiary. The beneficiary must continue to pay the Part B premium. They get very confused when they see all of those fabulous TV commercials telling them about $0 premiums. Just let them know that that refers to the premium that the plan may or may not have for itself. Has nothing to do with the premium Uncle Sam wants to get out of us every month. So they must continue to pay that Part B premium unless they receive assistance from the state. Then, of course, the state is paying it. But the point is, somebody's got to pay that premium. Now, they may pay an additional monthly premium. As I mentioned, the commercials do like to tout that there are $0 premiums, and there most certainly are plenty of options where a person may get a Medicare Advantage plan that does not have a premium for health or even the drug portion. But then again, there are some plans that do have premiums. It just depends on the plan, their preference. So it pays to shop around, which is what we're helping them do during this season. Now, they must pay other out-of-pocket costs. There's going to be co-pays and co-insurances for different services, so they need to be aware of that. Most Medicare Advantage plans do offer prescription drug coverage, so the vast majority of them do. Some don't, so you want to be careful when you are looking through plans that if a person needs drug coverage and they don't have creditable coverage elsewhere, that looking through Medicare Advantage plans, they definitely should consider highly those that have drug coverage. Now, with Medicare Advantage plans, a person may have to visit in-network doctors or go to in-network hospitals in order to receive care. This is primarily when you have an HMO. That's a must. There's no flexibility there if it's an HMO, a straight HMO. There are some HMO POS plans, meaning point of sale plans that may provide some flexibility, but for the most part, if it's an HMO, they have to visit in-network providers in order to receive care. If it's a PPO, which are the other primary option, there's two main options. There are a few others, but mainly in our area, HMOs and PPOs. So with the PPO, you have some more flexibility. They typically can visit out-of-network providers, but they will have higher co-pays and higher co-insurances. Now, to be clear, if it's emergency care, urgent care, or dialysis care, even if it's outside the area, then of course that's always covered because nobody has time when you're choking on something and they've got to get you to the hospital or you're having a heart attack. Nobody has time to go, hey, is this hospital Cigna? Because I can't go to this hospital if it's not Cigna. Chances are you can't speak. So just to keep it, a little light in here today, but emergencies are covered, urgent care, and out of area dialysis. In all other cases, they need to really be mindful of the networks and if their provider are in network. Some plans may include benefits original Medicare does not, such as vision, dental, hearing, and fitness and wellness coverage. A person cannot have a Medicare Advantage plan and a Medigap plan at the same time. And this is important. To join a Medicare Advantage plan, a person must live in that service area and be enrolled in Medicare Part A and B. Now, living in the service area isn't too hard for us because when we're checking, we're going to get their zip code and it will only pull up plans that are available to the person in that zip code. But they definitely have to have both A and B if they want to join the Medicare Advantage plan. So these are some of the questions that we'll want to make sure that we ask if somebody expresses an interest. I had someone express an interest in a Medicare Advantage plan, but they didn't have Part B. So I had to let them know, well, whenever you get ready to have Part B, we can revisit this concept. Until then, if you need drug coverage, we just need to deal with Part D. All right, so Medicare Advantage plans do have some additional benefits that are not available, and I won't tarry long here, but just as a reminder, additional benefits that those in original Medicare don't have. There are some special supplemental benefits for those who are chronically ill. And these are benefits that would normally be considered not primarily health related. But because a person's chronically ill, if it fits a certain criteria, there are Medicare Advantage plans that can offer these benefits if it shows that it will either improve or maintain that person's overall health. And then some other plan changes starting last year. They could include additional telehealth benefits beyond what Medicare normally allows. Also, people with end-stage renal disease, so kidney failure, basically. Starting this year, they were allowed to join Medicare Advantage plans without any prior restrictions. So if they do have end-stage renal disease, we are no longer asking that question before we can sign them up for a Medicare Advantage plan. They're free to join that just like anyone else. So that's a positive change. Now for enrollment for Medicare Advantage plans, same initial enrollment period as I mentioned with the Part D. Pretty much similar special enrollment periods that I mentioned with Part D. The only other one I can think of that would be different if they're retiring and so or if they had delayed taking Part B and now they're finally getting Part B, then they have a special enrollment period to get an Advantage plan because now they fit the criteria. And then, of course, back to the part that we're here for today, annual enrollment period, October 15th through December 7th. And then there's a special enrollment period just for Medicare Advantage beneficiaries, and that's January 1st through March 31st. If a person wakes up on January 1st and they are in a Medicare Advantage plan, they can take advantage of this 3-month period in which they can switch their Medicare Advantage plans, or they can go back to original Medicare with or without Part D. So that's another period that's coming up, and a lot of the same things that we'll see this period, we'll see during that time as well. And then for low income assistance, I mentioned earlier about waiving that late enrollment penalty. Um, there are two different types of programs. We have the Medicare Savings Program and we have Extra Help. For the Medicare Savings Program, which is administered by TennCare, there are three main categories you can see here. All three of those will pay the Medicare Part B premiums for the beneficiary. If a person qualifies for QMB, which means they're at the lowest income bracket, it will also pay for their Part A premiums if necessary. Most people don't even have to pay for Part A, but for the few that do and they find themselves in this situation, QMB will pay that. QMB will also pay their copays, coinsurances, and deductibles. So that's the main difference for QMB and the other two Medicare savings programs. Extra Help is through Social Security, and this is assistance with their Medicare Part D premiums, copays, and deductibles, which I do not have on the slide. Apologize for that. But it's assistance with their prescription drug coverage, premiums, copays, coinsurances, and deductibles, and it is administered by Social Security. And as volunteers, we know, but we want to encourage people to call us, call SHIP, and we can help them apply for one or both of these programs. And again, if they qualify, now if they qualify for the Medicare Savings Program, they will automatically be enrolled into Extra Help. However, there are a few people who will qualify only for Extra Help and not the other programs. So once we assess their situation, we can assist them with applying, and that can definitely help them keep costs down, and they can use that money for something else, for food or housing or something. So we definitely want to make sure that we let folks who are low income know that we are here to help them and that there are some programs that may be able to assist them. The 2021 benefits of having Extra Help with prescription coverage. A person can be deemed either full Extra Help, which is 100%, or they may receive partial Extra Help. And you can see the three categories there. For 2021, Part D premiums for plans which participate, those premiums can be reduced by up to $30.20. It also will reduce co-payments. If a person has full Extra Help, they will pay no more than $3.70 in generics, $9.20 in brand names. If a person has partial Extra Help, they'll have a 15% copay for their prescriptions. Extra Help also reduces the Part D deductible. If someone has full Extra Help, their deductible is zero. If someone has partial Extra Help in 2021, their deductible is $92. As soon as we get the 2022 costs, of course, we will make sure to get that information out to all of our volunteer team members. Also, a benefit of having Extra Help, no coverage gap. So with the coverage gap we mentioned earlier, where people would pay 25% of their prescription costs and what it takes to get in there, that won't apply to people who have Extra Help. And then again, that late enrollment penalty for anyone who has it will be waived. And so now that I've gone through all of the basics and a few of the updates, now we're going to talk specifically about preparing for the annual enrollment period. So Medicare beneficiaries should have received their annual notice of change by September 30th. Well, actually, let me take it back. I think it has to be mailed out or sent out by September 30th because I think my dad got his on the 2nd of October. Anyway, they're getting it around that time. So this lists any changes a plan will make for the upcoming year to their premiums, copays, and coverage. Now, when we're helping our beneficiaries, it's very possible that the annual notice of change was very slim and directed them to go to the website. They do have the right to call and ask them to send the full information because they don't want to check it online or maybe they have a hard time reading online. So do let them know that they can get that information that's online sent to them by mail. And plans for the upcoming year can be viewed as early as October 1st. So starting last week, we were able to see the 2022 plans on Medicare.gov's Plan Finder, and you can see the link for that there. So right before we get to Plan Finder, because I am going to show you information on how to deal with that, I want to just go over the Tennessee SHIP Part D worksheet. So we had a massive mail out where we sent this worksheet to beneficiaries that we've helped in the last year or two. Also, when people call us, we may send it to them. We can mail it to them. We can email it to them. And this is a worksheet that is very helpful for us. It allows us to run tailored plan comparisons for Medicare Part D and or Medicare Advantage plans. And it's helpful because it can sometimes streamline assistance. Sending this to us, we can already get the person's prescriptions in the system. We can run comparisons. We can mail it to them, or we can just be ready ahead of time if we have an appointment with them. We've already got a lot of the preliminary work out of the way. So when we sit down to meet with someone, we can just kind of pull it out and say, okay, here we go. So it can be helpful. And it's definitely helpful for remote assistance. So if this is someone we're not going to be able to see in person, it's certainly helpful that way because it allows us to share information with them by mail, email, phone, online, like we're doing now. So it's very helpful. And let me briefly show you all. I'm going to share what that looks like. Thought I had that available. Just a moment. Oops. Okay, looks like I'll have to pull up the. Wait, let me put this on pause for just one moment. Okay, y'all, I found it. I found it. Okay, so now we're going to share content worksheet. Ta-da! All right, so this is the worksheet that we have sent out to tons of folks and are still sending out by request. So this allows us to collect their name, all of the information that we would need to assist them, their name, their date of birth, address, all that contact information. On Medicare.gov's Plan Finder, as you'll see when I pull it up, if a person has has an account already, then they can use their username and password, or if they give us permission, we can use their username and password to pull their information up. Many times, a person may not have that information; they may not have an account, and so they give us permission to create an account for them. And so, what we need, of course, is their Medicare number that is on their red, white, and blue card. Let me back up. We need the name as we see here. Please provide your name as it appears on your Medicare card. So that's very important. The address that they have on file with Social Security. And then, of course, their Medicare number and their start dates for Part A and or B. Then we ask them some questions just for us to kind of figure out what their situation is, if they have extra help, if they have creditable insurance, if they currently have a prescription drug plan or an Advantage plan. It helps for them to tell us what that plan is. Although if they don't know or if they give us incomplete information, for instance, somebody will just go WellCare, and it's like, dude, in 2021, there were 6 WellCare plans. Which one? So if a person gives you incomplete information, but they gave you their Medicare number and their start dates and permission to create an account for them, fortunately, you'll be able to see that when you pull the account up. So we asked them how they would like to get their comparisons. Would they prefer regular mail, snail mail, email, or phone call? Um, and some people like a combination, that's fine. And then we ask them again some other things that might help us be able to figure out if they even need assistance. Do you have assistance with your Part B or your Part D? Yes or no? Would you like us help? Would you like us to help you apply for this? And if they say yes, we'll get in contact with them and move forward with that. Um, do they take meds? What's their preferred pharmacy? Do they prefer mail order? And then here, this is where they list their medications, the dosages, how often they take it, how often they refill it. So this is a very important part. And if they're able to send this to us, then that allows us to go into Plan Finder. Now, if you sometimes people will get a printout from their pharmacy. That's cool. I've had people handwrite it and send it to me. Well, they're probably handwriting on here, but I mean on an extra sheet of paper because they may have more drugs than this. That's fine. Or when people come and meet us in person, of course, we encourage them, just go ahead and bring your medicine cabinet, bring the bag, bring the little box, and that way we can read it for ourselves. Because we know sometimes folks' handwriting um, aren't the easiest to interpret. I'm thinking of my own. So if they do have the printed information straight from the bottles when we're meeting them in person, that's very, very helpful. Or they have a printout from the pharmacy. Only thing about the pharmacy is sometimes they give you a list of every month of the year and you kind of have to weed out the repeats, but it's fine. So that's the worksheet that we send. So if you get some of these, if you're assisting us, you may get this and you can input information into Plan Finder. So now that I've mentioned Plan Finder probably 500 times in the last 2 seconds, let's go ahead and actually take a look at Plan Finder. So we're going to share content again, and we're going to pull up Plan Finder. Well, actually, before I do that, let me take that back. We're going to go back to our presentation for just a moment because I have a few things to say about Plan Finder before we actually dig in there. So how about we do that? Let's go back to, okay, if y'all can just let me know, do you see the PowerPoint again? If you guys want to, okay, yes, thank you, thank you. Okay, so now that we're back here. So Medicare Plan Finder allows you to create an account or to search anonymously. Some people don't want to create an account, or as in the case of someone I was looking at yesterday, they don't even have any prescriptions. So there's really no need to create an account for this purpose. Now, if they wanted an account for other purposes, which Medicare.gov has plenty of reasons why you may want an account, that's fine. But just for the purpose of looking at their prescriptions, there was no need because she doesn't take any. So we can do an anonymous search. We can look at their Medicare Part D plans, Advantage plans, or both. Also, since we are in open enrollment, we can look at both 2022 plans and 2021s. As I mentioned earlier, there is sometime a need for 2021 plans if a person is turning 65 during this year, they're retiring and losing their insurance there this year, they just got disability during this year. So there still can be reasons why we need to go back and look at the 2021 options and not just the 2022 options. All right, so you can add the beneficiaries' prescriptions if they, and we can select up to 5 pharmacies, including mail order. Now, if we're logged into an account, the information that we put in there will be saved. But if a person is not logged in, if they wanted to go back and look at it later, they'd have to re-enter that information all over again. All right, so Medicare Plan Finder, the plans are automatically sorted by lowest drug plus premium cost. That's the default. You can switch it to other ways of looking. You'll see the estimated costs for the remainder of the year. You can enroll a beneficiary, or if they're feeling confident, they can enroll themselves directly through the website for most plans. However, for Medicare Advantage plans, there are some that are called special needs plans. Those are typically for people who are dual eligible through Medicare and Medicaid and a couple of other instances. Some of those plans cannot be enrolled in through the website. They would actually have to contact those plans by phone. And again, the 2022 information became live last week. Now, here's some of what you'll see when you go to Medicare.gov. It will allow you to preview the plans. You can see that on the left there, that little red circle. It'll allow you to just jump in straight to log in and create an account. And again, if you look down, it says need a 2021 plan. You can click that. Truth is, no matter which one of these you click, you're still going to go to this page. Doesn't matter. So you're going to go to this page here that says Preview 2022 Medicare Plans. And again, it gives you the option of either logging in or creating an account for someone, as well as the option of continuing without logging in. So this is the login page. This is also where you can create an account or do forgot password. Now, if you are looking to see if a person has extra help in Plan Finder, and the reason I definitely want to show you this on the slides is I'm not going to pull up someone's information on here, so we won't be able to see that live. Everything else we can see live. But let's say you logged someone in. It's going to take you to their home dashboard. This is like the top left corner of it. It'll show you what the person's current plan is, and then it has View My Plans. You can click that. It'll pull up this page. So for this particular person, had original Medicare with a WellCare Classic PDP, and then down here, and I didn't make this circle. My circle would have been way smaller and tighter. But whoever made this circle, they're really trying to get you to click Find and Compare Plans. So if you do that, then it will pull up this person whose name was blacked out, show you what that person's current coverage is, and then it'll let you know if they currently have any extra help. And in this example, the person did not. But if they do, it'll let you know if it's full extra help or if it's partial extra help, and if so, at what percentage and all of that. And then down below, of course, you go to, oh, see down here at the bottom, it shows you current extra help with drug costs. This example, this person has full extra help, and it lets you know $0 premium, $0 deductible, and it tells you the co-pays for the drugs. So that's how, if you are pulling up the person's information, you can see if they already have extra help. Because sometimes people will mark on the worksheet, I want you to help me apply for extra help. You look in, they already have it. So that's just one way to save a little bit of time. And now we'll take a look at the actual live plan finder. Okay, so there you have it. And like I said, it kind of really doesn't matter which one you click. It's going to take you to the same page right here. So we, of course, are going to do the, for demonstration purposes, we won't log in. So we're going to click this because really, other than pulling up the person's information, once you get to this page, it's going to be the same no matter what. From this point forward, it's going to be the same. So answer a few quick questions. So just for brevity's sake, we'll do drug plan. Enter your zip code. All right, so in this case, there's only one option for my zip code, so there's no need to do anything. But let's just say I picked one that had two options. So this is why it's important to find out from our beneficiary what county they live in, because there are some zip codes we don't want to make an assumption. Right here, 3002, which is typically Arlington or Lakeland. The majority of it, I believe, is in Shelby, but we do have a little bit in Fayette. So we do want to make sure because plans can change. The number of plans that are available to a person can change based on the county. You may have 26 plans available to the person in Shelby, but the person in Fayette, it may only be 23 plans. And I'm just making that up off the top of my head, but I have seen those differences. So you want to make sure you get that right. So just for giggle's sake, let's do Fayette. Here, they'll ask you if someone gets help with their programs. So for right now, let's go if they don't get any help, but I'll show you what it looks like if they do. Then, do you want to see drug costs? Unless they don't have any drugs, the answer should be yes. And so now we're going to type in some drugs just for purposes. So let's do lisinopril. And as you can see, when you start typing, it'll give you options as to what's closest, which is good because sometimes people misspell what their drug is. So if you get close enough, you can kind of go, oh, they said Raglan, they meant Reglan. So there you go. All right, so here you've got this. So if they've, we want to make sure that we have the right dosage. This may be the default, but let's say the person told us they actually take 20 milligrams. And let's say this person only takes it once a day and they get theirs every month. So we'll leave it at that. But as you can see, there's actually several options for frequency, but we're just going to be basic and do every month, 30 for the month. So we'll add that to our drug list. You can add another drug. So I'm going to pick one I know is expensive. You can add another drug. Oh, well, you go here and you check the dosage. I'm going to leave it at that. Let's say this person has some eye trouble, because I know that's typically expensive too. All right. And those little bottles, you'd be amazed how much they can cost. So one bottle versus a pack of three, we'll just stick with that. And we'll say they get one bottle per month. That should be good. So now let's say we're done adding drugs. So now, once you're done adding drugs, this brings you to the opportunity to um, find pharmacies. So here it says a distance of 5 miles, but you can change that to 1 mile or expand it all the way up to 25 miles. So now, if there's a particular pharmacy they've told you that they like, you can type it in so you don't have to scroll down and look for it. Or you can scroll down and look for it, whatever works best for you. So let's just say, for our example, that our person does not mind getting mail order, but they do shop at Kroger. But they say, let me see another option just in case something's cheaper. So we're going to give them Walgreens. All right, so we've got three, but as you can see, there are up to 5 slots here that you can fill. So now that we're done selecting our pharmacies, now it takes us to the plans, and it tells us up here that we are viewing 2022 plans, which for the vast majority of the people we're helping, that's exactly what we want to do. Um, Now, just to show you. But again, let's say we have somebody who's got a Halloween birthday, which would be awesome with candy. So you can select Show Me 2021 Plans, and it'll let you know that you're in the 2021 section and that everything you're viewing is for the rest of this year. But let's go back now to the majority of our people who are looking for next year's stuff. So we're looking at 2022 plans. And as I mentioned before, the default is to sort plans by lowest drug plus premium cost. You can change that. You can filter if you want to, because some people are very specific about which companies they do and do not like, particularly which ones they don't like. You can filter by star ratings, because some people like that sort of thing. But if they don't express any particular pleasure in that direction, you can just leave it what we have. So as you can see here, 26 drug plans available in 38002 Fayette County. So it's going to, and they're going to show you the first 10. And just like with most websites, let me scroll to the bottom real quick. When you get through with 10, you can go to the next page and see more. So let me go back up. So it's going to be sorted again based, the automatic sort is lowest drug plus premium cost. So these are generally going to be the most cost-effective plans are the ones you're going to see on this first page. So the general information you're going to see here, you're going to see the plan name, the plan number, their rating, the monthly premium, the yearly drug cost. Now here it says yearly drug cost retail. We did put 2 retail pharmacies, so we would have to click on details to see which pharmacy is giving us this price. But we also see that for mail-in, it's a little bit cheaper. It tells us the deductible for the plan. It also tells us that only one of our 2 pharmacies are actually in network. So that's what we get just by looking at this page. Now we can select add to compare, and we can compare side by side up to 3 plans. So let's do that. So you hit that, and now you can see side by side, we have 3 plans. And so as we look at them, we can see the plan names, we can see the monthly premiums, and as we scroll down, I do like that it keeps the names at the top so you don't get confused. So you scroll down, and what I want to show you here is drugs covered, not covered. So all 3 of our drugs are covered by all 3 plans. And then here it shows you the pharmacies that we selected. So as we can see with SilverScript, Kroger is a preferred in-network pharmacy. Walgreens is not in-network at all. $8,000. Sheesh, they don't want to do that. And then mail order. And then it shows you also for the other 3. So just at a glance, this is really helpful. You can kind of speak to these 3 plans at one time. But let's say you want to look at details, and it's always good to get details. And this may be what you want to print and give to the beneficiary or mail to them or email to them. Well, that would be download as opposed to print in that case. So it's going to show you, again, it's going to review the premium, what the pharmacy cost would be. Now, on the prior page, let me go back just a sec. On the prior page, what you saw here, 1504.88, that's taking into account the drugs and the premium cost. When we go into the plan detail, we're going to see the monthly premium, and we're just going to see the drug cost right here by itself. There is a place where you can see that other number again, but at the top, that's not what you're going to look at. So when you see this, don't go, hey, how come that says 15? This says 14. Because right here, it's just giving you the drug costs for the retail and drug costs for the mail order. So when we go down, it gives you an overview, repeats the premium, repeats the deductible, contact information, and for our purposes, we're just going to skip on. Here it shows us our three pharmacies, and again, we see which one's in network, which one's not, mail order is. So now here we've got yearly costs by pharmacy. And so it gives us a side-by-side view of the expected yearly costs for each pharmacy. So it shows us for the drugs, um, by drug and then by total. So again, you can see here 1426.88 for Kroger, well over 8,000 for Walgreens, 1420 for mail order. So mail order is a smidge cheaper on the prescription cost. And then when we scroll down here, we have a bit more information, which is really helpful. And I'm just going to be honest. I don't care what they say. This was not here last week. I'm just going to say it. This was not here last week. So this is what I mean by what I'm telling you here today. Just check again in a week. Something's bound to be different. So we have the total yearly drug and premium cost. So this repeats the price that we saw on the previous page. It lets us know when the person is expected to meet the deductible. It lets us know when the person is expected to go into the coverage gap, or people might call it the donut hole. And then it estimates when they'll get out of the donut hole, which if they go with the two preferred pharmacies, which in this case would be Kroger and mail order, they're not coming out of the coverage gap, which most people don't. Some do, most don't. However, if they go through Walgreens, because it's out of network, and they're going to be spending so much money, then yeah, they're going to get into catastrophic because they're going to spend a whole lot of money. So in that case, they'll get in September, but I wouldn't want to spend $8,000 just for the privilege of dropping down to a low copay for my drugs. But that's just me. Then it gives us the estimated monthly drug costs. I won't belabor that point. Oh, the reason it's different over here, mail order, because of course mail order is every 90 days. So they're just showing you estimated every 3 months. So that's why you're seeing blank spots here. And then, now this is very important. If we print this out, all of this that I'm about to show you will automatically be there. Otherwise, if you're viewing it on the screen, you have to do your own handiwork. If you want to see the Kroger, you got to click on it for it to expand the Kroger costs. I won't go into Walgreens mail order because the setup's the same, but I just want to mention what's important about this view is it's going to show us 5 categories, although if a plan has no deductible, it will show you only 4. So you're going to see the retail cost, which is this first category, the cost before the deductible, the cost after the deductible, cost in the coverage gap, cost after the coverage gap. This is going to cause our beneficiaries the most confusion. So this is why we want to make sure that we understand what this chart means so that when we explain it to somebody who may or may not be frantic, what they're talking about. Because I'll get them going, retail costs, I've got to pay. No, that's the retail cost. Cost before deductible, I've got to pay. Well, you're not going to most likely pay this whole $537.29 because your deductible is $480. Now, there is some funky math about that. It's the deductible, then there's a small percentage, and I don't remember if it's 20 or 30%. But once they've met the deductible and then paid that little extra percentage, then they're considered to be out of the deductible phase. So, but once they are out of the deductible phase, then their costs are going to drop down to these prices here. So Januvia will be $46 monthly. The Latanoprost will be a buck. Oh, I picked the wrong eye drop. That's not expensive at all. There is one that's high, but you know, it still fit our purposes. The Lisinopril is a buck, so that tells you the monthly cost. It lets you know what's going to happen when it gets in the coverage gap. Now, of course, the person's going to go, it jumps up. Well, yes, because it's going to jump up to that 25% of the retail cost. So that's why they have retail costs here to let you know, when you do the math, what that's going to look like in the coverage gap. Of course, these two drop down to 44 cents. And then if they go into catastrophic coverage, then that's what this last category is. And like I said, that repeats for Walgreens and mail order. and you can definitely click on those. View more drug coverage. This is just kind of some of the general rules. Um, this is good to know if there are quantity limits for one of their drugs. Yes, there is a quantity limit, and if you hover over that, it tells you what that quantity limit is. Lets you know if they need prior authorization, which none of these drugs do. Then this just kind of verifies what we listed on their drug list. So if we need to make any changes, we can click this right here, change drugs, and we can go in and we can make alterations. It reminds you what's not covered, and then star ratings. And again, most people don't care, but a few people really do, and they actually can break that down to several different categories. So that in a nutshell is looking at a Part D plan. Let's go back to our main page, just real quickly show you what it looks like when we're dealing with the Advantage plans. So if you, that might have been too quick, sorry. There's going to always be this toggle here that you can, this puts us back in the drug plan. If we click, this puts us back in the Medicare Advantage plans, because we will have some people who want information on both. So for Medicare Advantage plans, you can filter it based on plan type. Some because I have had people tell me I only want a PPO, so I definitely can filter that for them. Some people, again, have certain notions about certain drug companies. I mean, not drug companies in this place, Advantage plans. And that very well may be that they've already done the homework and talked to their providers, which is good. And so they already know that their providers said, hey, they'll take anything, Aetna and Cigna, not the rest. So if they already know that information, it's cool to narrow it down. If they don't, give them the best information you can and definitely remind them that before they make a decision about an Advantage plan, to please talk to their providers, find out if they do accept any Medicare Advantage plans. If so, are they in network for those plans? And they can always contact you to get information that's specific to what the doctors said. So definitely remind them of that. You can filter it based on whether or not you do or don't want to include drug coverage. I've only ever had two people who said they don't. One of them had a good cause. Frankly, the other one, I'm just going to tell the truth. No, they were just being stubborn. It's not my job to force them to do anything. I informed them of the consequence of such a decision. They were perfectly happy to accept it, and so I'm perfectly happy to go with them. But I did want to just make sure that they were aware, make sure that this wasn't a mistake, that they hadn't misunderstood me. But no, they had understood me just fine. But in most cases, they're going to want drug coverage. And again, if a person qualifies for a special need plan, you can do this. Now, if a person has Medicaid and you've logged in as that person, very likely one of these is already going to be checked for them. So there's that option there. Just like with the drug plans, it's sorted default drug plus premium cost, but you can change that to something else. And then the basic setup is the same. A few extra things that you see, obviously, because it's specific to being a Medicare Advantage plan. But otherwise, we're looking at the same thing in terms of premiums. And here it does remind people that just because it's a zero premium has nothing to do with Uncle Sam wanting his money. What the yearly drug and premium cost would be. Now, on here, it's not showing the mail order, you'd have to actually click on the details to see that. And then other costs, if there are any deductibles, and then the out-of-pocket maximums. So just remind them that these costs, the 10,000 if they go in and out of network, or the 5,900 if they remain in network the whole year, these only apply to their Part A and Part B costs. It doesn't apply to their drug costs. So that's important. Over here, important information for the beneficiary, their primary doctor copay, their specialist copay, and then some of these things up here. Just like on the Part D side, we can do side-by-side comparisons. So let's just do that. So if you do that, again, set up the same. That's a different name. WellCare No Premium HMO POS. WellCare Give Back HMO. See, every time you go into the new year, you get some new names. So it's really cool sometimes to run down and see what is and is not going to be available for next year. So those are definitely two new ones on me. AARP Medicare Advantage Walgreens, that I recognize. So again, it reminds you that open enrollment starts October 15th, meaning, they don't give you a button to enroll because you don't need to enroll somebody for 2022 right now, unless their birthday is January 1st, 2022. That's a whole nother ball game. We'll talk about that later. But just again, it's going to go down side by side. It's going to pick a few important items. from the Medicare Advantage side, all of these things, which are certainly important to them. Of course, we're focused primarily on the prescription portion, but definitely this gives you enough information to answer questions about, hospital service, outpatient and inpatient, all of that good stuff. Now, just like before, we can see here that all three of our drugs are covered by all three plans. You can see here the costs. So the looks like the cheapest pharmacy cost is right here, Walgreens at 788 and 2 cents, but the cheapest mail order costs are going to be our two WellCare plans over here, 722.01. So let's just take a look. I want to see what this new WellCare plan looks like. So let's hit that one. All right, so set up similarly to the Part D, where you've got your premium. Of course, they've added deductible and primary care doc, and then estimated total drug costs, just like before. So if you're reviewing this with them on a computer, obviously you can jump to all of these different little things. Um, Otherwise, when you print it, it's going to show you on paper the whole shebang. Um, I just want to kind of remind everybody again, primary care specialists, remind them, of course, to speak to all of their providers, not just their main doctor, but, well, I talked to my primary care doctor. Okay, and how about your gastroenterologist? Oh, I forgot her. Yeah, you need to go talk to her too, or at least her office. And then just a reminder, as I said before, emergency care is always covered. That copay may not always be the same, but it's always going to be covered. And so is urgent care. You can see there it says always covered. So that one, they don't have to be bound by providers, networks, or coverage areas. But let's just jump down for the sake of time to the drug coverage portion. So it's going to be a similar look to what we saw before. It shows us that all three of our pharmacies are preferred and in network. Again, it's going to show us the yearly drug costs. And here it tells us when they're going to meet their deductible. So in this case, because the person is only going to spend about $813, it looks like they actually don't even have the opportunity to go into the donut hole. So that's not presented here for them. Again, we can see the monthly breakdowns, or in the case of our mail order, the quarterly breakdowns. And then just like before, if you click on the pharmacy, you can take a look and see what those costs are going to be. So this is what I mentioned about some will only have 4 categories because the Medicare Advantage plan did not have a deductible for drugs. And there are some drug plans that also don't have a deductible, not many, but there are a few. So in that case, you'll just have the 4 categories and not the 5 that we saw before. Otherwise, the principle of what we're looking at remains the same. And then, of course, they've got extra benefits. And then you can jump down if they care about the star ratings, they've got that there. So that's Medicare Advantage plan in a nutshell. Now, one thing I do want to show before we move on to the next portion, because I am a little bit behind on my schedule, but that's okay too. I just want to show, well, we can't show it from this screen. So let me go back and back. So let me click on Show Me 2021 Plans. And the reason I'm doing this, not just because we may be helping someone who needs a 2021 plan, but since it's not October 15th yet, I can't actually show this function to you on the 2022 plans. So let's say that we actually do want to enroll someone. So it's going to tell you you're joining. It's going to tell you what you need, the information that you need in order to do this. And then you hit Join Plan, which obviously we won't get in trouble doing here because I'm not going to put anybody's real number in. But I just wanted to show you how that application starts. So you've got this information, and it's going to ask what their enrollment period is, why they're enrolling. For open enrollment, obviously, that would be the reason. But in case you have someone who has a superseding enrollment period, such as they're new to Medicare, or they already have Part A and now they're finally getting Part B and they're joining an Advantage plan. So they've got some reasons here. If it's January 1st through March 31st and they're in a Medicare Advantage plan, you'd select this option. Then if they qualify for a special enrollment period, it gives you all of these different types of special enrollment periods, all of these different types. And so you'll just carefully go through and select what best fits that person's situation. And once you do that, you can hit next. And it really is only about, I think, 5, maybe 6 pages maximum after you get through this point. As long as you have their Medicare number, their real, well, not their real name, their government name, their name that's on their Medicare card, their address that Social Security has, and then it'll ask you some leading questions. Once you get through all of that rigmarole, you'll get to the last page where it'll ask you to make sure that everything you've entered is correct. So I'm saying this for those who are nervous that they're going to make a mistake. There will be a page where you can verify that you've put in the correct information for that person before you actually hit submit. And once you hit submit, you will get a confirmation page, and you will want to print that off and give it to or mail it, or download an email, whatever works, to the person, because they'll need that information just in case it takes a little longer, especially with the way mail is running, for them to get their um, card and plan information. It's normally 10 to 14 days. It could be a little longer, so they need that confirmation number. But you also, as a volunteer, want to keep that for our records, as well as print the plan that they're joining, those plan details, print that. And if they had a current plan or previous plan, print that too. Now, if they're new and they've never had a plan before, then you're just going to print the one that they're going into. But if they had one before, print that one for comparison's sake. Give the beneficiary the plan they're going into, give them the confirmation page. For our records, keep both of those as well as the old plan. Because when we enter into STARS, we need that information. Even if you're not going to personally enter it into STARS, you want to make sure that you keep that information. If it's by paper, go ahead and mail us that copy along with, the beneficiary contact form, which we'll get to in a second, so that we can upload it into STARS. If you're doing it yourself, scan it, upload it into STARS, or if you're downloading it straight from the computer, make sure that you upload it. So that's very, very important for us as volunteers and for staff members. All right, so that's Medicare.gov in a nutshell. While I pull up the next part, if anybody, let's just pause. If anybody has a question that they want to either share in the chat, or if you want to unmute yourself and ask while I pull up the next portion, feel free to do so. Okay, looks like just checking the chat real quick. Don't see any questions just yet. Okay, so let me go back to the PowerPoint. Okay, can you all see that where it says Plan Finder Live demo? Oh, okay, somebody's typing a question. Okay, good. All right, so we have a question. It says, if a person is married, but only one person is working, they still use the married income for IRMA. If they're filing jointly, yes. It really depends on how they're filing their taxes. If they are filing jointly, then whatever income is reported on that joint um, tax is what's going to be used. So that actually helped out someone the other day, because while her husband, if he had been on his own, definitely made more than 88,000. By the time you added her income into it, which I think was just a itty little bit that she got part-time at the beginning of the year, together they did not. They definitely did not make 176,000. So I assume that would be the same for the person who has no income. Um, it's still, I mean, do people file separately just because the wife has no income? I don't know that, honestly. Again, the important thing is how they file, not whether or not she has income. If they filed a joint tax return, then the amount is 176,000. If they filed individual tax returns, even though they're married, then it's 88,000 for each person. So if they do it singly, obviously she's going to be under, and if he's above 88,000 and he filed on his own, then he's going to get IRMA. But if they file jointly and they together are under 176, then there shouldn't be an IRMA. All righty, that's a very good question. Yeah, and like I said, I actually just encountered that the other day. Alrighty, and again, remember that's from 2 years ago. And if there has been a drastic change between 2 years ago and now, a big life change, or for instance, sometimes the reason that income in 2019 was high wasn't because they actually had income, but they had an insurance settlement. So they can actually make the case to Social Security that that's not indicative of our life at all. That's because some idiot hit us with a car and they had to pay. And that's not going to happen again, we hope. So they can make a ask for a readjustment. and that they would do that through Social Security. Alrighty, so now we're going to go back to all right, so we have again enrollment fraud prevention, and I won't read everything that you're going to see on the screen because I'm not Lonnie Hitchcock, and she's far better at this than I am. But I am going to hit the highlights to make sure that we are definitely all aware of how to protect our beneficiaries from enrollment fraud. So the 4 points to remember. Well, actually, it looks like technically 5. Anyway, so you want to know the rules about how agents the Part D and the Advantage plans, as well as their agents, how they can contact people and how they can market people. Know how to avoid potential fraud, how to protect yourself from fraud, know how to help people report suspected enrollment fraud and marketing violations, and definitely know who you're dealing with. If you are dealing with an actual, or if the beneficiary is dealing with an agent, they need to get that person's full name, not just their nickname, but their full name, whatever they have their insurance license under. That's what we want to get is that person's full name as well as their organization and a phone number. All right, so avoiding enrollment fraud, we want to watch out for people who pressure beneficiaries with time limits. Now, it's true, of course, that a person needs to enroll by December 7th in order for the change to be effective January 1st. That's true. However, if somebody is putting excessive pressure on them for time limits or they're lying about the time limit, well, if you don't do it by this weekend, this offer is gone. That's who we want to watch out for. Watch out for people who ask beneficiaries for any of their personal information. No one should need that. Now, remind them, of course, if they are dealing with the SHIP counselor, then it's okay to share their Medicare number. We don't need their bank information unless we are faxing for them their their Medicare Savings Program application. Then in that case, I'm just faxing it. I'm not even looking at it. But otherwise, let them know that if they contacted us and we contact them back, that they can feel comfortable working with us with their information. However, if they still don't feel comfortable, that's okay too. Just give them whatever information you can and let them call Medicare or the plan and deal with it that way. But let them know if anybody calls them out of the blue, that should be a red flag. We're not going to call out of the blue. But if somebody calls them out of the blue, that should be a red flag. Anyone who threatens them with the loss of their Medicare benefits if they don't sign up. You can't lose Medicare benefits just because you don't pick a drug plan or you don't pick an Advantage plan. You lose your benefits because you didn't pay, basically, but not because you don't go with this company or that carrier or this person. If they offer gifts, that's a big no-no. There's a limit as to how much can be offered, and that's not to enroll. That's like if they're at a presentation and they're saying, hey, we've got donuts over here or something. But if they're offering a gift, hey, if you enroll with us, you'll get this really cool leather carrying case for your laptop. Mm-mm. If an agent says they represent Medicare, they don't. They may represent their company that's contracted by Medicare, but they do not represent Medicare. And then, of course, anybody that comes by uninvited to their home without notice, you didn't ask them there, you didn't set an appointment for them to come there. That's something that you want to watch out for and report. Other ways to protect yourself, of course, protecting their Medicare number, protecting their Social Security number, watching out for any unsolicited phone calls, especially if they ask for personal information. They should let them know, remind them, if you want proper information, go to the authoritative source, government websites. Medicare.gov is a government website. Medicare.anything else is not a government website. Last year, I had the Dickens explaining to someone who just would not understand that, yeah, that's not Medicare.gov. Them telling you that this was the timeline was wrong. You needed to go to Medicare.gov. Well, and she wanted to say, well, I should be able to appeal because no, that's not an appealable cause. The fact that you did not pay attention to the website that you were on, that's not an appealable cause. That doesn't mean that you might not be able to report them for fraud, but just saying that I should automatically get an appeal because I was on the wrong website. You went to that website. Rely on the reliable ones, Medicare.gov. I had another person that I was helping who insisted that Medicare.gov told them a bunch of bogus stuff. I mean, the minute they said it, I knew it was bogus. None of that's legal. And I told her, you didn't see that on Medicare.gov. Yes, I did. No, you didn't. Yes, I did. This went on for 20 minutes before I finally got her to give me the information, and I was able to let her know I'm reading it word for word. This is not a government website. But I thought it was. So definitely rely on government information. Let them know that they have the right to request translation services. Here at the Asian Commission, we can get in contact. We have some translation services here on, well, I won't say like in a building, but we have services that we can use for phone translation. And also through TCAD, as a ship volunteer through TCAD, we have access where we can get a phone translator if we need to. Make sure that they know that anything an agent tells them, get it in writing and review it before they make a final decision. Let them know that they have the right to choose how and when and where they get this coverage. Do their homework before joining a plan. Don't just join a plan because somebody said, oh, it's going to cover all these doctors. Check with the providers. Check with the providers. Look at your budget. Look at the drugs that you take. I know some people who switch to an Advantage plan never even bother checking on the drugs, then want to get mad that it doesn't cover my such and such. Well, you have to make sure that it does before you jump into those shark infested waters. And I only say shark infested because there's so many opportunities for bad actors to get in there. I'm not talking about anybody who's a legitimate agent. And then, again, check with all of your providers, including your DME suppliers, if they take this plan before you join it. Check with the star ratings. And I know that we probably think the star ratings are subjective, and they are, but Medicare has a way to see if it's a very low performing plan. You want to pay attention to that because low performing plans, 2 stars and under, if they've had that for 2 or 3 years, then there'll be a little icon next to it letting you know this plan has been, kind of circling the drain for a while. You might want to consider that in your decision making. Rules. There are rules for meeting with an agent, and you can always go to this website and get the full rules in order to know how to best help beneficiaries. But here's a summary of some of them. Um, Plans and their agents or people who work with Medicare it is okay, lawful for them to give them plan materials. It's okay for them to tell how to get more information. Um, Tell them about the options you'd agree to discuss. If you told somebody you want to talk about a drug plan and that's all you agree to talk about, and they come to your house, that's all they're supposed to bring up. They're not supposed to bring up anything else that they sell, or else that's a violation. It's okay for them to give an enrollment form, and it's okay for them to collect it if you actually completed the enrollment form. If you just put in a little bit of information and they take it up, who knows what they can do with that. So only give it back to them if you're sure that you're ready to enroll and you've actually completed this form. And it's okay for them to give you business cards to say, hey, if you want to give these out to your friends and family, that's just them trying to make a living. It's not okay for them to just start randomly calling your friends and family, but it's definitely okay for them to say, here's my card. If you'd like to share my information with someone and they're interested in contacting me, then that's perfectly legitimate. Some other things, here's what they can't do. They can't charge a fee for this. If they tell you, oh, well, I can process your enrollment for $20, red flag. They shouldn't steer you one way or the other. Let's say you have someone who works for, and I'll just say Company X. Let's say Company X has 3 types of plans. They should tell you about all 3 of them, give you the information, see how it best fits you, and then let you decide, you know what, let me go with number 2. They shouldn't go, oh, well, we've got 3 plans. Number 3 is the only one that's good, though, so we're not going to talk about 1 and 2. They shouldn't do that. They should not communicate incorrect information about their plan. Shouldn't say, oh, we're the best or we're the highest ranked, especially since Medicare has these rankings. There's no need for them to go and fob off a lie. It's okay to tell the truth and say, well, if you look on Medicare.gov, we do have a 4-star ranking. That's fine. But don't go around saying, we're the best, we're the highest ranked, we're the this. They're not supposed to do that. They're not supposed to talk about any plan options that you have not already agreed to discuss unless you ask about them or the beneficiary asks about them. Again, don't no pressuring based on time. They should not say, hey, can you give me the names? This is what I mentioned before. Again, if they say, hey, here's 5 business cards. If you want to just give it to your 5 good friends, I appreciate your business. That's cool. That's just work. But what they can't do is go, what's your sister's name? What's your sister's phone number? What's your sister's email? And they shouldn't pressure you to sign the enrollment form before the person's ready. Some examples of enrollment fraud. There have been agents who enrolled a beneficiary into a plan without their permission. I did speak with someone that happened to. The person did have a meeting with them. They were perfectly happy with that meeting, but they said, I'm sorry, it was a telephone meeting, telephone conversation, and the person was perfectly happy with that phone conversation. The person did specifically say, I am not ready to sign up. I don't want to sign up over the phone. If I do sign up, it will be in writing. So if you will send me the book in writing, and if you'll send me XYZ information in writing so I can review it, and then if I decide, and send me the form. And then if I decide that this is the way I'm going to go, I will fill out the form, sign it, and turn it back in. But I will not enroll over the phone. And that person enrolled them over the phone. So that took a minute to get changed. An agent should not lie to a beneficiary about whether or not the physician takes the plan, especially if they don't know. They just straight up didn't know, but just said, "Oh yeah, they take Dr. Smith." No, they don't. And some of these other things would be examples of enrollment fraud. Some scams you want to watch out for: bogus Medicare representatives. If somebody calls up again telling them, I represent Medicare, no, they don't. We all know Medicare does not call folks out of the blue. Threatening a loss of coverage, fake rebate notices, counterfeit sales, and fake emails. If they feel that a plan has violated the marketing rules, they need to report that to SMP, the Senior Medicare Patrol. And many of you have either met her in person or on the internet before. That's Lonnie Hitchcock. She is our statewide SMP coordinator, and we are all her loyal subjects. And you can reach her, or the beneficiary can reach her at the toll-free number you see on your screen, 866-836-7677. And yes, I have that memorized probably in my sleep. If they suspect these fraud or marketing violations, they can also call the plan, because it could just be an error. It might be a mistake. So if you feel friendly and want to give them the benefit of the doubt, call them and just say, hey, I saw something on here. It looked wrong. It looked odd. What's going on? There may be a good explanation for it, and they can take care of it, get it fixed for you right then and there at the company level, or they may not. You can also call Medicare, of course, 1-800-Medicare, and you can see what that translates into. And again, they can contact Tennessee SMP. Yes, these will all be made available. Thank you. And I know I missed a couple of chat questions earlier. I'll go back and grab them. You can go to see Tennessee SMP on her Facebook page. If you're on Facebook, just search for Tennessee SMP or at Tennessee SMP, and you'll find that. And she posts a lot of information that's beneficial to beneficiaries. So please share that with them. This is her contact information. Again, her toll-free number if you need to mail her, or if a beneficiary actually wants to mail her some information that she can kind of investigate. And I don't mean that word 'cause she's not an investigator, but she can kind of get the ball rolling by checking out the information. They can send her information, mail, email, fax. And that number below her email is her direct line if you're local in the Cookeville area. Otherwise, use the 866, and then that fax number right there. The last two items I want to do before we get to Q&A, again, just very brief beneficiary contact form. If you're helping someone, this is very useful. Again, though I know that some places, especially if you work at some senior housing facilities, you may have your own form that you use. That's fine. Basically, as long as we get the information that we need to collect in order to put into STARS, that's super awesome. But this form can be useful in helping us to put information into Plan Finder, along with the Part D worksheet. So either one of those would be really helpful in terms of how we can make sure that we collect information. If you are using this form, feel free to send it to SHIP. You can send it to ACMS by email, fax, or mail. Or if you just enjoy doing STARS, if that's your source of amusement, you could go ahead and upload it yourself. And then reporting deadlines, just as a reminder, reporting information to ACL, Administration for Community Living, basically where the bucks come from. Everything has to be in STARS by the last day of the month following when you counseled somebody or had an event. Now, because we are part of Shelby County, we have some internal things that we do, and therefore, if you can get things in by the 15th, we would really appreciate it because it would help us with our internal struggle. But again, legally, ACL cares about the last day of the month. Shelby County cares about the middle of the month. And frankly, the middle of the month is a good timeline because that way we can kind of go back and make sure that we've got everything in before the end of the month. We can see if there's anything missing that we need to put it in. So, and again, that's the month following. So let's say today, which is October 8th, and let's say today's when you talk to Beverly Jones. That information needs to be in stars for county purposes by November 15th. ACL's purposes, November 30th. Yeah, October's the 31st, December's the 31st. Yep, November's 30th. Okay. So that's when that you would want that in. And now, contact information once again for the Aging Commission. I'm sure by now everybody knows. It's been 10 months already. They've moved. The Aging Commission is downtown. You can see the address there. Phone number has not changed at all. And feel free to pass along our ship.smp email address, and that will reach the ship counselors as well as anybody on the INA team who can assist. There's our Facebook pages. There are our Facebook pages and our Twitter page. The Tennessee Ship toll-free number is right there. I'm sorry about putting that survey link. That's normally what I use for when I'm not talking with volunteers, like for the public. I forgot to take that off, so you can ignore that part. But that's the Tennessee Ship toll-free line, which of course most of you know already. And now I'll open it up for questions and answers. We've gone through pretty much everything, and I actually managed to get to the Q&A portion almost on time. That's amazing. So feel free to ask in the chat. In fact, I'm going to pull up the chat so I can see if I've missed any questions, or you can unmute yourself. That is the wrong box to look at. You can unmute yourself if you want to ask on air, but let me scroll back through the chat box. Okay, lady asked me yesterday if we were just doing Part D, who she can talk to about Medicare Advantage. Just curious why we say Part D enrollment instead of Medicare AEP. Good question. Part of it is just for the sake of brevity. When we print stuff, sometimes stuff just doesn't fit what we're trying to do. Also, I think, and this is just me spitballing here, because Part D is available not only as standalone, but as part of the Medicare Advantage, it still is Part D enrollment because the enrollment period is for prescription drug coverage. So Medicare Advantage plans do include that, but primarily space. Um, Annual enrollment, that's still a newish term. They told us to use annual enrollment, and yet on all their materials, they use open enrollment. And I found a lot of people, sometimes if you just say open enrollment or annual enrollment, they're really confused. I can't tell you how many people go, oh, okay, so annual enrollment's coming, so I can get a Medigap plan. That has nothing to do with it. Okay, annual enrollment is coming. I can enroll in Part A and B. That has nothing to do with it. So we do need to be more specific, but I agree with you. There should be a better way to express it briefly, but make sure that they understand we're talking about drug coverage no matter how you get it, not, this is when you can join Medicare, period. Because I have had people say that, and I'm like, is your birthday coming up? And no, this isn't that. This is not that moment, and that confuses people too. So that's just kind of my takeaway from it. Others may have better, more thorough answers, but that's just kind of what I got for it. Yes, the PowerPoints will be available. I will email them, sorry, out to everybody. And yes, oh, hi. Somebody asked if the recording will be available. Yes, I addressed that earlier. A recording will be available. And let me do apologize for not having the previous recording available. As you can imagine, as open enrollment comes upon us, we get the call volume has jumped, and I meant to have it up by Monday, and I just didn't get to it. But like I said, I will have both last week's webinar and today's up by today, if for no other reason than I need a clear conscience going into the weekend. I just can't live like that. It's my mom's birthday weekend, and I need to feel free to, eat all the chocolate cake I want without a headache. So I will have them both up by this afternoon, and by afternoon I mean by the time I walk out the door at 5. So if you don't see it by 3, don't get upset. It will be done by 5 because I'm leaving. I'm going out the door today at 5. So I will. Oh, thank you. Well, yes, it's my mom's birthday, so I'll let her know. And yes, I will. Even though it's her birthday, yes, I will enjoy the chocolate. Uh, does anybody have any other questions? Oh, it's because I hit that screen. Sorry. Okay, there we go. I'm going to go ahead and stop sharing the screen, but feel free to continue asking. Actually, no, let me leave it just in case you have a question that I need to go back over with on the screen. So if anybody has any questions about any part of today's presentation or something that I did not mention, and you have a question about. Oh, thank you guys. I appreciate that. I really do. Thank you all. Well, just in case anyone does not like asking questions while we are recording, let me go ahead and stop the recording.